Today we're discussing a case that we recently did. This patient is a 22-year-old son of a former patient of mine that we did a full mouth reconstruction on her. Her main concern was that he had done braces several times and he had done orthognathic surgery in order to bring his upper jaw forward and his lower jaw back because he had a discrepancy in which his upper jaw was larger than his lower jaw, and which is very different than the general public. And after all these years, after all the surgeries, his bite was still not proper and the aesthetics was not where they wanted it to be, and he's 22 years old, and therefore they wanted to see what their other options were because they didn't want to go through another orthodontic process without knowing that they're going to get the kind of outcome that they wanted. So in his case, looking at the picture, the problem he was having is he didn't have any bite in his back teeth. He was constantly hitting in the front teeth here and here, and his side teeth were pretty much edge to edge on this side. And another thing that I noticed was that because of his larger lower jaw, he was having spacing, and orthodontics would not be able to fix that because there was no room for those teeth to go in. And he also had very small teeth for his big smile. He had small, kind of yellowish teeth that, as you can see, he had a lot of braces done. You can see the scratches on the surface of the teeth in which they kept putting on and taking off the brackets. And so after the discussion, we decided that doing 12 porcelain veneers and 6 lower ones, 12 uppers and 6 lower ones would get the outcome that they desired, the aesthetics and the functional outcome. Here, as you can see, is the retracted photo. This a little bit more clear as far as where the bite goes. And another thing you can notice is the reason we ended up doing 12 teeth instead of our typical case, which is 8 to 10 teeth, is because his molars in the back were always tucking in. And when he smiled, everything dropped off. And what he wanted to do was he wanted to have a nice full smile. And so therefore we decided to include those in the case. And the reason we ended up doing the 6 lowers was I had to tuck these guys in a little bit more towards the tongue, lingually, in order to give space for the upper teeth. So that was, we decided to do that more on a functional aspect as opposed to aesthetic aspect. The patient came back the day after we had prepared the teeth, taken impressions, and put him in temporaries. It's a little overexposed photo, but this gives us kind of a better idea of how the teeth will work over time, where his bite is, and the aesthetics of it. He was very happy with the aesthetics. We also ended up adjusting the bite a little bit. I added a little bit more to his right side, but overall, he was very happy. And so he left, and with the temporaries, he was able to use them to see how they function. And 2 weeks later, he would come back for the final delivery. This is the porcelain on the model. As you can see, we take these pictures not just for our sake. We take these to be able to see in a static form if the line angles, if all the aesthetics are exactly what we imagined. We don't hesitate to make changes at this point and make sure that once the patient comes in, we are ready for the best outcome. The patient came in and we tried in the right side, as we always do, to make sure that the right side and the left side are a perfect match, because we always want to make sure that we're delivering exactly what we promised. A beautiful arch form, beautiful match. At this point, the patient came back the next day. The gums are still healing, but as you can see, we have a perfect arch form. Very natural. You can see the translucency in the front teeth and the way everything's going. Now you can see that these are over the lower teeth, like natural teeth. And the function, these are nice and tucked in, and we're in perfect function. Not only that, in perfect aesthetics. As you can see, the patient is very happy with the outcome, and so am I. I hope you enjoyed this, and see you next time.